Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Struggling with unpaid medical bills from before your Florida Medicaid was approved? You might be able to get them covered. This video will walk you through how to handle those old bills using what's called retroactive eligibility. Florida Medicaid can sometimes cover your medical costs for up to 3 months before the month you applied. This is a huge help. So, if you applied in April, Medicaid might cover bills from as far back as January, February, and March, as long as you were actually eligible during those months. The very first step is to check your approval letter from the Department of Children and Families, or DCF. It will tell you the exact start date of your coverage. This date is the most important piece of information you have. Now, here's a common misunderstanding: you don't send the bills to Medicaid yourself. Your doctor's office or the hospital is responsible for billing. Your job is to act as the messenger and provide them with the right information. Once you know your official Medicaid start date, gather all the unpaid bills from that retroactive period. Make a clear list of each provider. This could be the hospital, the emergency room doctor, the radiologist, or the lab that ran tests. You will need to contact the billing department for each one of them separately. When you call, you need to say something like, "Hello, I am calling about a bill from date of service. I now have active Florida Medicaid coverage, and it is retroactive to insert your start date." They will ask for your Medicaid member ID number. You can find this on your Medicaid card or in your online portal. Politely ask them to please rebill the service directly to Florida Medicaid and remove the bill from your name. What happens if the provider says no, or that it's too late? Be polite but persistent. Providers do have a deadline to bill Medicaid, which in Florida is typically 1 year from the date of service, so in most cases, they still have time. If they have already sent your bill to a collection agency, you must contact both the provider and the collection agency immediately. Inform them both that the bill should be processed through Medicaid. If you're still having trouble and the provider won't cooperate, your next step is to call your Medicaid health plan. The phone number is right on your card. They have member services staff who can help you, and sometimes they can even contact the provider on your behalf to get things sorted out. Getting old medical bills paid by Medicaid takes a few steps and some phone calls, but it can save you from a lot of debt and stress. Remember to be organized, have your Medicaid ID number ready, and don't be afraid to follow up. We hope this guide was helpful for you. Thank you so much for watching. If you found this information useful, please give this